Thanks, Sarah Jane. Good evening, and we are in the home stretch now, and thanks for being with us throughout this long day, but it's been fantastic so far. So rounding up the conversations, so the WHA Resolution on Diagnostics was a turning point for many countries who are advancing or prioritizing global health security and accelerating access to universal health coverage. And we at FIND are committed to working with the countries to support the countries in the realization of the full potential of the resolution by supporting its implementation. Specifically today, we are making some commitments towards expanding our support to the countries in the implementation of the resolution across areas such as offering technical support to countries who are involved in the development of the diagnostic strategies, generating evidence that will inform and update the WHO Essential Diagnostic List, and at the same time supporting the countries in the development of their national essential diagnostic lists. We are also committing to working with stakeholders across the diagnostic value chain to support the development, validation, and implementation of diagnostic and imaging technologies at the community as well as the primary healthcare level, including making these technologies available at global access pricing. We are further committing to boosting the diagnostic literacy by building the capacity of healthcare workers and laboratory technicians working at the primary healthcare level, supporting regional manufacturing initiatives, harnessing the in-country potential, and also facilitating technology transfer agreements, working with countries to strengthen their regulatory capacities, especially with the national regulatory agencies, and also advocating for harmonization of the regulatory policies across the global and the regional stakeholders. And last but not the least, coordinating the commitments towards the realization of the diagnostics piece of the 100-day mission as a part of the pandemic preparedness. But we know that, having said all of that, realizing the full potential of the resolution is going to take a village. And that is where we are looking forward to work with our partners and stakeholders. And we are advocating with them constantly to make similar commitments to support the countries in the implementation of the resolution. To that end, we are very pleased to launch today an online open access portal for partners to make these commitments. This is a snapshot. It's obviously a busy slide, but you can look at basically the kind of organizations which are supporting the resolution, the type of commitments that they're making at the global, regional, and country levels. And also we have 15 recommendations supported so far, with 19 organizations having submitted their commitments, and obviously implementations across countries, region, as well as the globe. So with this, I would like to invite. So with this, I would like to invite my fellow panelists for the day. And I would like to start with Dr. Fatim Chan Jallow, who is the Senior Medical Lab Specialist of the Global Fund, to please join me. Ms. Reniko Gade, Senior Advisor at Clinton Health Access Initiative. Mr. Jean-Willem Chegron, who is the Vice President of Government Affairs at Philips, but is today representing DITA, and Dr. Daniel Transcend of GFAN. Well, thank you so much for joining us, today at the FIND's Diagnostic Day. And maybe I'll start with Fatim and request her to talk about the commitments that the Global Fund is making in supporting the countries towards the implementation of the diagnostic resolution.
Good afternoon, everyone, and thank you again, FIND and the Lancet Commission, for inviting the Global Fund. And again, thank you, Sanjay, for that. So for the Global Fund, there has been actually tremendous increase in funding for lab systems. And thanks to COVID, because prior to COVID, for lab systems, the investment in grant cycle 6 was about $100 million for lab systems. And this does not include funding for in vitro diagnostics or equipment, so just lab systems. But since COVID and now, the funding for lab systems strengthening has improved and increased by about fourfold. So we are now at 500 million. And this is unprecedented in the Global Fund, and I think globally as well. So in response to the WHA resolutions, and as part of our modular framework, which is the framework that we use for countries to really align their funding request, and also in response to our strategy, which is people-centered approach and integration, we do support lab systems governance, lab leadership. We do support and empower lab leaders, especially in low middle income countries. And including also support to development of and implementation of national lab strategic plans. And this we work across partnerships, but also making sure that the country leadership is at the forefront of implementation. And previous to Grant Cycle 6, lab leaders in countries were not involved in Global Fund grant development. But we have had a massive change and a shift where lab leaders are encouraged and empowered to be part of the process. And with this, we're seeing a lot of change in implementation. However, we want to see more. We want to work together with partners to support implementation of the funds that are in the grants, that are in countries. And as you all know, with the Global Fund, we're not a top-down agency. Countries define their priorities, and these are then articulated in funding requests, which they then support, which they then submit, for funding support. So implementation of grant-supported activities have been one of our major challenges. However, over the years, we have seen a lot of capacity being built in countries, funding from a lot of partners. And we have actually built capacity in some countries that what we do now is, instead of encouraging fly-in, fly-out TA, which we call it, we're actually embarking on what we call peer-to-peer learning, making sure that countries support each other. We encourage countries to, for example, go to Zimbabwe to look at their sample transport system and how that is implemented, such that, and this is because we've seen that when countries visit each other and see what they have done, it's sort of like boost implementation in their countries. And we're actually doing a lot of that. We also encourage integration. We're moving away from silo systems. Our funding requests, our modular framework emphasizes integration. We don't support nor fund siloed lab systems. So sample transport systems, if they have to be funded, need to be integrated from the national down to the lowest level of the healthcare in the country. And in addition to the funding that goes to country, this year, this implementation cycle, we have had an additional 55 million from the private sector to actually support and catalyze innovations in countries, including supporting regional initiatives, working with regional partners, as well as global partners. We have worked with several partners, including the WHO, in actually implementing the Global Lab Leadership Program, something that is much needed in certain regions of the world, especially in the low middle income countries. Finally, optimizing the network optimizing the diagnostic network is an area that we also support to improve effectiveness and efficiencies, and also ensuring value for money. And basically, I'll just end there for now, but we look forward to working with a number of you, a number of partners, but also, most importantly, lab leaders in countries to move the resolutions. Thanks.
Thank you, Fatima, and I think we at FIND can certainly attest to that, because we've had the privilege of working with Global Fund in India and so many countries, and supporting countries in a lot of lab system strengthening initiatives. So with this, I'll turn to Renuka to maybe talk a little bit about the commitments that WHA is making towards the implementation of the resolution.
Thanks, Sanjay. I was going to say exactly that. It's nice to stand next to the donor whose projects we implement many times. And so just to say, over the last 20 years, WHA, which was established by President Clinton, initially to address the HIV pandemic when it was an emergency, has been working on scaling technologies for HIV, but then broadened or expanded their agenda to look at not just drugs, vaccines, but also diagnostics beyond HIV, TB, women's health, cervical cancer, and other cancers in the gamut. So we've been doing this consistently, focusing on low middle income countries. But the WHA resolution obviously breathed some new life into diagnostics. As Kevin said, the Cinderella that's not invited to the party, and how can we change that? So when WHA happened, we were very excited. FIND took a really strong initiative to say, let's come together with Lancet and establish a diagnostics alliance. We were part of that working group. Made a lot of progress, but again, I think we heard Elodie say, there is no funding in diagnostics. So for very good reason, that's kind of probably not moving, but it was a pleasure to hear Adriana say that there's going to be some kind of consultation and engagement led by WHO, so the agenda will be kept alive. So I won't talk about all the commitments that WHA is making. It's on the tracker. Congratulations, FIND, again, for making this transparent and launching it here 1 year after the WHA. It gives a sense of progress, if you will, even if the discussions this year was not so much on necessarily diagnostics resolution. We hope this will keep it alive. But I'll talk about a couple of new things that I think are relevant in the context of WHA's new resolution. One that, Ken, you started speaking about, the FDX, the Future of Diagnostics work. So the Gates Foundation commissioned this work. WHA is the secretariat for this body of work that, and we launched it on July 23rd last year. But it's not about WHA, it's really about bringing together the global stakeholders in diagnostics, whether that's Global Fund, WHO, Lancet, FIND, CDC, PEPFAR. So it was really coming together of several multiple stakeholders to say, what can we do to develop a common agenda for diagnostics based on the resolution. The time is now so that there is transparency among the players in terms of determining what are the priorities. And it's taken a year, as you said, several rounds of consultations, both, and with Africa CDC and ASLM for the continent of Africa, to be very specific. So it's taken a lot of time getting feedback from countries, from the global agencies. We had a panel at the Africa CDC after ASLM conference in Cape Town in December, and shared some initial findings. And we're now in the process of consolidating the report, which is going to focus on what could be common goals, short-term, medium-term, and long-term, to accomplish a new state in diagnostics across essential diagnostics lists. You know, WHO is on this 4th round of essential diagnostics lists, and yet several countries don't have national EDLs. Is there a good reason to also develop a regional EDL? We've been partnering with FIND on EDL implementation even before, and so how do you strengthen that? Can we come up with a big goal to say, in the short term, in the next 2 to 3 years, we want 80% of all countries to have EDLs, but not just have EDLs, but actually start implementing them. And so we can kind of, that's an example. Similarly, you're looking at what can you do with DNO, and how do we take that forward across new tests that are coming in? How do we look at strengthening primary health, focusing on maternal and child health? We did an analysis across 10 countries, and I'm not going to get into the details of which, but it's really quite challenging or quite disturbing to note that sometimes it's just 12% of the facilities that have any basic testing for maternal and child health at the primary level. How do we look at digital, and the digital in the context of digital innovation with AI-enabled technologies, in the context of just the systems development? So we're looking at structural issues, which oftentimes you'll say you can't have a diagnostic because there's no infrastructure, so let's start addressing them, but let's address them in such a manner that everyone agrees and aligns that these are issues, this is what needs to be done in the short term. Here are some kind of metrics, a scorecard, if you will, to say, to keep us honest to accomplish those WHA resolutions. And we hope, I don't think Adriana is here, and if she is, or if someone in WHO, oh yes, Adriana. So we hope that this can become a really good input into the meeting that you will call with diagnostics, because this has been, WHO is also part of this input. So it's like taking that to the next step in the absence of alliance, so to say, but to really say, here's what we need to do, and if you address some of these issues, then comes in the technologies that industry, and industry is doing a great job in bringing forth new tests, new technologies, like never before, right? Whether they're rapid, whether they're lab-based. And so how do you make them reality, and how do you create that access? So that's kind of what we are working on. We had an excellent discussion with Sergio just a few days ago, and we said, how can we bring in the competencies, core competencies of FIND, core competencies of CHAI, to collectively problem solve some of these complex challenges while we work individually on our agenda. So I think in the whole context here, what we're trying to say is working in partnership with entities, with governments that's been our mandate anyway, but really developing a common agenda based on the resolution, so that there is no second guessing on what we need to do collectively as the diagnostic community. So that's the update, Sanjay.
Most comprehensive. And as you said, FIND and CHAI have worked well in the past. We've been great partners, and we look forward to continue working with you towards the implementation of the resolution. So maybe with this, I'll turn to Jeanne to maybe give an overview of DITA's commitment towards the resolution.
I was just sitting, but I will stand up. And you can sit now if you like. Yeah. Thanks. Jan-Willem Schijgrond. I'm with DITA. In my private life, I'm at Philips. DITA is the Diagnostics, Imaging, and ICT and Radiation Therapy Trade Association representing that industry globally. And we have a partnership with Adriana for a long time, addressing the diagnostics needs. So it's great to see that resolution there. So happy birthday, or happy Resolutions Day. And when we were talking about that, and when we were talking from the Lancet Commission about the need for diagnostics and what you said about, it's really important to get that diagnosis because otherwise you can't do the treatment. I had to think about my management school background. Say you can't manage what you don't measure. It's basically you can't medicate what you don't diagnose. Maybe that would be then your new slogan, and maybe that could emphasize a little bit the need to focus more on diagnostics. So if we're talking about diagnostics in the context of DITA, the trade association, what are we talking about? It is the diagnostics imaging, really important, and it was called out specifically in the resolution, in particular diagnostics imaging, because it's so complex and it's also so unavailable, like ultrasound and X-ray and SPECT-CT and CT and MRI and that kind of stuff. But it's also next generation sequencing, it's PCR, it's in vitro diagnostics, all of that combined. It's complex, it requires training, it probably requires maintenance and service and installation. A lot of this stuff just breaks down if it sits somewhere after a couple of months. So it needs to be nurtured like a baby. Okay, so this technology is super important. And I thought, if we try to understand how big this problem now really is, where's the gap? How big is this gap? So it was already referenced. We are investigating the gap. So I thought I'd try to get a feeling of the gap now. For CT scanners or MRI scanners or ultrasound, if you're in Europe, there are about 25, 30 of these devices per 1 million inhabitants. So 30 CT scanners per 1 million. So you live in a big city of 1 million, there'll be 30 CT scanners in the area, there'll be 30 ultrasound, there'll be 30 MRIs. That's your average. If you're in Switzerland, it's double on average, yeah? So you're good here. Everybody here, fine. If you're pregnant or you have an accident, you're fine. There's many, many, many of these devices around you. If you're in LMIC, it's about 5. So 25 in Europe, double that in Switzerland, and 1/5 of the average in LMICs. But I include China and Brazil and Indonesia in that. So if you then go to like a country like Pakistan, it's like 0 on 1 million, something. So the gaps are massive. So if we are investing in the infrastructure of diagnostics imaging, you need a lot. So you need a lot on the regulatory side. And that's why in our commitment, we are working with IMDRF and WHO to see, can we harmonize the regulation? Can we not do the same type of approval for the CT scanner in the United States as for China, as Australia, as Europe, as in Malawi? Can we just take each other's data and have regulatory reliance? Can we also harmonize, the procurement and the standardization in that area? Can we harmonize on maintenance and services and training? Can we harmonize on using basic safety standards? It's super important. This stuff is, if you don't know what you're doing, it can be dangerous. So let's make sure that we have the basic safety standards in place. They're there. So it's just a matter of adoption. And then finally, the unique device identification. So can we roll that out? And we'll be working with WHO, but working with the IMDRF, the regulators, so the International Medical Device Regulatory Forum. Do you want me to repeat that? Yeah, yeah, important one. Yeah. To help in aligning on regulation, in particular on the training. So I think that the tools are out there. It's really important that we get this done quickly, because the resolution calls for the gaps to be closed. I told you what the gaps are, more or less, and the gaps are widening. They're not getting closed. And I think it's important, therefore, that we see the basics out there so that we can start to deploy, start to diagnose and treat. And I think, looking forward to your second birthday, it might be good to have a resolution on the diagnostics imaging. It's such an essential part, especially if we move towards not only the communicable diseases, but we see this rise in NCDs. Next year is the NCD. We're not going to do anything about NCDs if we can't diagnose. No, you can't medicate what you don't diagnose. NCDs you can definitely not treat. Stroke, cardiovascular disease, cancer, forget it. Without these diagnostics, especially diagnostics imaging, it's not going to happen. And climate change is exacerbating that. Hopefully tomorrow we'll see the adoption of climate and health. Stroke and all those NCDs, they increase with every change in adverse weather event. So we'll be needing more of these diagnostics to understand when patients come in, can we diagnose them within the day? Can we diagnose them even faster so we can get them the treatment and we can save lives? And I think that's what your resolution is all about. And hopefully, Vodita, you know where we are. You know how to pull us in. We're all here behind you and hope we can close that gap. Thank you very much.
Thanks, Jan. Maybe I'll turn over to Daniel to talk a little bit about GFAN's commitments to the resolution.
Thank you. This resolution is breaking. A lot has happened. It was amazing. Diagnostics was really brought to the attention that it garnered coming out of COVID was huge, and we did something about it, and we should commend ourselves for getting that done. That's a huge deal. But this is a political resolution, and a lot of the to discuss about the impact is all biomedical. And what's happened since then politically, particularly for the people who are least likely to across the world. And I mean, speaking, putting back a little bit on my global fund, I was at the board level before going to GFAN and the society. the amount of money that we raised from donors to do this COVID-19 response was also unprecedented. And the benefits that we're continuing to achieve through that has continued through the investments that you've listed, that you named. However, we could do as much, we could have some, still the response to improved diagnostics still remains largely unfunded. But if we make it worse for people to actually get diagnosed, this whole resolution will fail. And it doesn't matter how much innovation that we can bring to bear. We can try to do it frugally, or we can try to do it the Switzerland way. Nothing's going to change. And that is where we are. It's a bit of a because it's, we take steps forward. And actually, this resolution was a giant leap forward. And this resolution came because of COVID. Pandemics, as we learned through COVID, they start in communities. And they start because we're able to diagnose them and we're able to identify an issue of concern and go up to, to reach the pandemic. They will also end in communities. They end with diagnostics and treatment. But the journey from the start to the end is really where we have our work cut out for us. And right now, the way I see it, we're sprinting with the technologies. AI and everything else, a year later, the world looks incredibly different. And if you continue to see where we will go in the medicines pipeline and what AI, the promise of what AI can do for us, it's tremendous. Yet, in other places, it's only getting worse. Climate, as you've mentioned, is one of the things that we're not. The political situation, putting back my Global Fund hat on, for TB, HIV, and malaria, the strategy is about putting communities at the center. What do we mean by that? It's about reaching those that have not yet been reached. And we're about almost 4 decades into the HIV. Almost 25 years since the Global Fund was founded. We are moving towards the SDGs. And if you look at where we are now, we're doing the right thing, but we have to do more. And the more that I think we have to do is to, rightly so, focus on the biomedical and the scientific and the technological innovations. But we also need to think about how we're delivering this politically. What are we actually doing to move the needle? How are we reaching that last billion? And I mean, I can't even say that anymore because global population continues to expand. So like, where are we exactly? On every single measure of the SDG 3, we're off track. And if you look at how diagnostics can be catalyzing to achieve those, then I don't mean to be a Debbie Downer, I'm the last speaker. We have our work cut out for us. 1 year on, we have tremendous results, and we should applaud ourselves. But do not get lost in the applause, please. We have so much to do. So much to do in terms of delivering, utilizing, using policies such as marketing to be able to improve domestic capacity so that people can actually get access to diagnostics that are made and they can afford them. We need to do more in the regulatory space. We also need to do more in terms of laws and protect the human rights and access services that they need. You know, we could do we could do a bit looking at the service delivery model to ensure that they're fit for purpose. I think, I think the resolution, the spirit of the resolution, calls for us not to just, it calls for us to be really innovative. This is what we've wanted for decades. It is here. In that spirit, I urge everybody here to do more. Thank you.
Well, thanks, Daniel. I think those comments make a lot of sense. You know, all the advancements in the technology, they obviously need to go hand in hand, and we need to make sure that these technologies get to the people who need them the most. So I think we still have some time. So if it's all right with the panelists, maybe at least one more question each, and then we can probably turn it back to our audience for some Q&A. So maybe I can start with Jan. Maybe switching the cycle. So Jan, you spoke earlier, while talking about your commitments, that there is a huge disparity in the availability of imaging infrastructure when you look at the high-income countries and the low-middle-income countries, and when you go down to the low-income countries. I think one of the challenges there is the affordability and also the complexity of the technologies. And just to give you an example, when we are talking about these handheld imaging devices, which obviously have the potential to revolutionize diagnostics for diseases like TB at the community level, but to get to those devices, you really need to spend almost like $50,000 to buy something like that. So just to say that one of the barriers to the LMICs and the LICs having these technologies is that they are super expensive. So as a part of your commitment to the resolution, are you guys doing anything about improving the affordability, the ease of use, and also the the maintenance of these machines within the LMICs and the LICs?
I was going to say at the birthday of this resolution we give a 10% discount, but I'm not sure if I can speak for all the companies. Now, look, there's unlike with pharmaceuticals, there's if you make an MRI in Europe or you make it in China or Indonesia, the costs are going to be more or less the same. In fact, it's very interesting to see that some of these products, the highest level of products are being bought by some of the least developed countries. And we've been trying to advise you, look, there are cheaper alternatives. So I think there's one right sizing. The other thing is we start to see productivity. So if you look at what's the cost per patient rather than the cost of the equipment. And what we're seeing is that AI is increasing the productivity of these machines and increasing the diagnostics capability. So it's, for some of the images, you take about 30 to 40 minutes normally, and that's going down to 2 to 3 minutes. So that means that suddenly that product becomes 10 times more efficient, more productive, and therefore the cost per patient drops suddenly by 90%. And you start seeing that countries are starting to invest in that and understand that. So the World Bank and the Asian Development Bank and the Islamic Development Bank, they're all starting to see that they can help invest in these infrastructures over time, because these things, they last for 10, 20 years. And starting to reduce the cost per patient. It's also important that what you said about the training, that a lot of this equipment, handheld but also not handheld and heavy infrastructures, are being enabled by AI to reduce the pressure on the healthcare professionals. Radiologists are some of the most burned out populations, healthcare professionals in the world, because the need for imaging goes like that, and the number of radiologists that are being added to the core, to the cadre of radiologists is going like this. So there's like a 100% difference in that. And so without AI, we're not going to be able to treat more patients and meet the demand. I think that there are massive innovations happening. So I think it's also important that ministers of health are being helped and assisted, for example, by WHO, to understand, what am I buying? Am I buying a 10 Tesla MRI or am I buying an ultrasound? Very often you can do this, for the things that they're going to use it, you can do the same thing with a cheap ultrasound. And there you need the technical competence that Adriana and the network can have, but governments don't necessarily always dare to ask. And finally, and I will say that, there is a big market for refurbished equipment. For all the big vendors offer that. And that is already at a lower cost. But what you see is that the biggest market for refurbished and if you like circular economy models is actually in the United States. And you would think, well, the United States, is that a country that cares about recycling? No. But they do care about money, right? So they see that if they get the same quality at a lower cost by using refurbished systems, they'll buy it. Now, what we see in developing countries, to your point, we are so concerned about money and price, is that, well, why don't you take the refurbished option? You get the same examination for most of the stuff you do, at the same quality, at the same warranty levels, at a lower cost. And they say, nah, I want a new one. And so the ability, because they're afraid that they're going to get something that doesn't work. So there are the technical assistance to help if you're really trying to reduce your cost per patient. AI, productivity, understanding what you're buying, looking at circular economy models, there's a lot out there that can be done now that we're not seeing yet as best practices. And then, as we said earlier, with good diagnostics, you're going to increase your GDP by 2%. And I'm convinced that radiology and technology is often 2 to 5% of the healthcare system cost in Western world. In LMIC, it's less. It's able to reduce the rest of the healthcare system's cost significantly, probably half. So an investment in radiology or technology reduces your overall cost of your healthcare system, and I think that's where the big gain is. You still get the 10% today.
Till midnight?
Yeah.
You know, just to add on to that comment, right? I mean, like you said, there's so much innovation and AI enabled. I loved your pun. You know, radiologists are burnt out people. Like it's anyway. So we are. You know, I wanted to just share an example of an innovation being done in India with using CAD as a basis for looking at TB diagnosis, and you have X-ray machines, portable machines. You could potentially take them out into the community, detect more TB than ever before, but in the process also detect potentially, if it's not TB, what kind of other lung abnormalities are you finding? And so certainly you're leapfrogging in the technology space, and the innovation enables us to accomplish the resolution goals like never before. So I was just excited to hear that, and I couldn't agree more that AI-enabled innovations today are for TB. I foresee that happening for breast cancer, and you could look at even screening solutions in that context and space. So your time has come, Philip. I know you for many years. We've been working on your work in Kenya for I don't know how long, but now is, I think, the first success is even inclusion of the imaging in the resolution. So I think it's more to see, hopefully, from an action point.
Thanks, Renuka. So maybe a quick question from Daniel. You know, how do you see the role of civil society and advocates in holding governments and organizations like FIND and CHAI and others in sort of, you know, accountable for fulfilling our commitments?
Well, I mean, that is our role, to hold institutions accountable. I think a part of it is institutions being responsive to civil society. I think we're in an age now where, you know, we've been around, we've earned our place at the table as your partners. I think that accountability works, not just us pushing. We can work synergistically. Often accountability is framed as you're not doing this well and you need to do more. You know it, you exist to do more. You know, I like to change the thinking around this. Tell us what we need. Sometimes this relationship is maintained by a dynamic where civil society just don't know enough information. And what we see is that we go back to our communities and we see the need. We see where things aren't working. But you often know this. I think a part of it is a much more transparent relationship, wherein we have a relationship where accountability, where we can meet in forums like this, we can hear from each other, we can share information, and you can ask us what we can do to get your strategy to work. Ultimately, civil society, if you want to put it in another word, we're your customers, we're your patients, we are the people who you've designed your technologies to meet our needs. It is the relationship needs a complete shift. We don't have to be fighting all the time. We get so much more done when we can work together. And I think in this time where, let's be frank, GHIs are having a difficult time raising resources. It's not the time to be fighting. Like, we have bigger targets and we want the same thing. So I think that's the kind of framing that I want to put around accountability. You know, it's about transparency. It's about recognizing our unique role as well as yours, and finding new streams of work to get things done.
Thanks, Daniel. And with FATIM, so I mean, with all these investments that Global Fund is making in the countries, how do you think these investments can help unlock, better investments from countries from their domestic budgets to support diagnostic strengthening?
Thank you. And like I said, we have been working and advocating for lab leadership and also development, but also implementing integrated national lab strategic plans. And as part of this year's, this funding cycles initiative, we have implemented what we call matching funds, in which we incentivize countries to also match one-to-one, dollar-to-dollar of some of the investments that we're giving to countries. So I think, this is a way, and also continue to advocate for budgets for labs, national budgets, funding for national lab strategic plans, but also leadership of the lab directorates to be able to get their own funds and also manage, and also, support from partners, but also lead the coordination and collaboration in countries.
Thank you, Varun. Well said. Well, can we have a big round of applause for our panelists?